I'm here to give you some a treatment for this muscle. This is called calf muscle. In the layman term, the muscle called is a gastrocnemius muscle that is located in here, this side. The gastric muscle has a two head, the lateral head and the medial head, and also connected to the soleus muscle, which is all attaches to the Achilles tendon, which is located here. This muscle sometimes it causes a cramp, like pulikat. So the importance of this muscle, this muscle is connected to our heart. It's called the peripheral heart, because every time you walk or you use this muscle, it always pumps towards the heart. So this muscle is very important. Once it's blockage somewhere here, it's no more blood flow towards the heart, so it causes of the heart problem. So I'm going to show you later on about how to give massage and give strengthening the muscle if the muscle is going to weak. First of all, how to do the massage treatment. I'm going to give some skin rolling on this area. You need to warm up the muscle first before you're doing the treatment. And sea bowing style. And especially I do the cross hand stretch. Once the muscle is already warmed up, you can see some hyperemia on this area. That it means it already circulates the blood flow. So I'm going to put the oil. So once I give to this side the treatment, and the client is still pain, it means that the client is encounter a plateau. Once the client is encountered tight in this area, that connected, it means the client has a plateau. But the client encounter of the tight on this area, the client encounter at the high heel. Or heel arch, I mean. So I'm giving some massage. Some client encounter pain. You see, it reacts because it's pain. Because the soleus muscle in part is very tight. You okay? So if possible it happen like this, that you are encountered cramp or pulikat, you need to give the muscle strengthening. For doing this technique of massage, I'm only the person that can give to the client, because the client itself is a different kind of strengthening and stretching for their muscle to do it. But this massage technique I show it to you, this is the technique that I give to the client. If possible that he or she encountered the cramps. So when I finish the effleurage, to push my hand towards me, and this is called the isometric exercise. That it means the muscle is not going to move. So if you can push it to me, and hold for 6 seconds and relax. One more time, 6 seconds, relax. And one more time, 6 seconds, relax. So the muscle itself is going to strengthening by doing that exercise. To do some another technique for, it's called isometric or isotonic. The muscle itself is moving. So I'm going to do this area, and then if you can push your knee, it's moving. It's something like that. So this kind of exercise that I give it to the client to give the strengthening of the muscle. After the strengthening, the muscle is getting short because of tight. So I need to give some stretching exercise. So the stretching is just relax. I'm going to push towards like this. And you see the muscle is stretching. And hold for 15 to 30 seconds. And that's it. Once I give again a massage, the client, the muscle is already relaxed. So he or she not encounter any pain at all. It means that the muscle itself is weak, and also the muscle is a lot of scar tissue around it. So you need to break it down, the scar tissue, by doing this friction. So are you ready? So I'm going to cross the fiber. The fiber direction, as I said, is a vertical direction. So you need to do the opposite direction. So when I do the friction around this muscle. Painful? The reason I put this direction, this muscle, because before, the client has a tight in the soleus muscle part. If the gastroc and the soleus is both tight, you need to do the friction along the Achilles tendon, like this. Like hold for 2 minutes. It's a big difference once it's finished. And after that, you put an ice pack. So after you finish that, you can give another massage for the client. And that's it. Thank you.